The views expressed on this podcast are Peter Dekom's opinions based on his legal experience, research, and academic work. The podcast does not offer legal advice. For any legal matters, always consult an independent attorney who can assess your specific situation. And now, on with the show. So clearly you think that universal health care is the solution. I would like you to make the case against it, particularly so that I can understand why would somebody not want universal health care?
If you convince people that socialism is the greatest evil in the world, and you can attach the label socialism to the thing that you want, that's it. Because the only people who benefit by not having universal health care are rich people who don't need it. And I mean rich. Because when you get medical costs, I mean, you ever go in a hospital and have something really nasty happen to you? One of our producers went to a hospital and had a blood infection. It was cheap. It was $250,000. If you have a medical condition like that, can you pay for it? Someone who's rich, $250,000 is chump change. To you, it's more than you make in years. So I think at some point you have to ask yourself a question. Do you want to subsidize the rich at the expense of your health? Or do you want to have a healthcare system that treats all people, all men are created equal? Throw in women in that, obviously. It's a generic man term. That's your choice. There is no defense for it unless you absolutely wish to benefit the moneyed class. There is no defense. Too dramatic for you?
No, it's not too dramatic. It's just you and I both know so many people who vote against universal health care.
Because they think it's socialism.
And you've already made that case. So hopefully people listen to this podcast episode.
If they believe, if that's what they want to, look, I can't say, you can say, you know why? I don't think we need sun anymore. So I'm going to make the sun. There's some things that if you think about it and analyze it, ask yourself a question. Is universal health care in every other mature Western country on this planet creeping socialism? Do you think Germany, that makes Mercedes, BMWs, Audis, Porsches, is a socialist country? Do you think Italy, with their Ferraris, they're a socialist country? At some point, wake up. You know, what they're saying is we have a cost. It is costing us in global competition. We don't compete well with other countries that have this kind of health care because we have to charge for it and make our products cost more. Everything we do costs more because we have to cover the cost of illness and accidents in our cost price structure when we sell stuff. How are we benefiting? The countries that have the health care are benefiting because their prices, our products are much more competitive than ours. We don't have that competitive advantage. As a matter of fact, a few years ago, Detroit moved a lot of its car manufacturing from Detroit across a very short span of space, a river or two, a lake or two, into Ontario. And they paid the workers exactly the same and saved a fortune on health care because it was covered by the government. We are not competitive. When people come to work sick and spread a disease, we reduce our productivity. Why are we doing this to ourselves? We're not competing with the rest of the world. We're not capitalists with brains. We're just capitalists. You have to use your brain and be logical. And logic seems to have left the building and been replaced in significant part by vapid conspiracy theories.
Okay, given that healthcare, like so many other services in this country, depends on policy and laws, but then the very nature of that politicizes it, how can we de-escalate this topic of healthcare in our discussion so that we can mitigate the political nature of it and be able to discuss it and find solutions, troubleshoot this area strictly focused on health and care and compassion and prevention as opposed to keeping it in the political field?
So how about looking at every other country in the Western world that has had this exact same issue? In 1961, Canada, which at that point had some limited experiments with provincial health care, passed universal health care administered at a provincial level, and it was done under the Diefenbacher prime minister regime back then in 1961. The next year, the entire Diefenbacher party group, whatever, was tossed out of office because everybody said creeping socialism. Today, you go to Canada and you say, okay, choose ice hockey or healthcare. Ice hockey is going to lose because Canadians now cherish it just like the Brits do. It's not like the systems work perfectly. They need to be fine-tuned and they need to be adjusted financially and otherwise. I mean, I would say, for example, I would have medical school and nursing school free to anybody who needs it. And in exchange, you're going to give me a couple of years of your life after you graduate to provide medical services to places that I need it. Maybe the military, it may be in rural districts, it may be wherever we need it. But you don't have to pay for the tuition with cash. You can pay for it with your services. We got to stop thinking about everything in terms of money. How much would you pay if I basically said I'll add 10 years to your life? What's it worth to you?
To add 10 years to my life?
Ask you. I could ask 10 years of your life in healthy condition.
That's the gold standard. I mean, that would be everything to me.
Well, what if I told you I can cut your life back by 10 years and save you some money?
Cut my life back by 10 years and save me money.
Yeah, you don't have to pay as much for health care but you'll die 10 years or younger. It's your choice. That's kind of the way you got to look at it. Because either you have health care without limits and caps, so if you need it, it's there. Or you say, okay, I have to pay for it. If I can't pay for it, I'll die. There was a thing on 60 Minutes the other day where they had these new CRISPR-designed treatments for little children with genetic disorders that are easily fixed, except it costs about $2 to $3 to $4 million to get the serum that's necessary to cure the kid. Insurance company said, too much money, die, bye, dead kid. And you can make those decisions. I don't like making those decisions.
Nobody should be put in that position, position to have to.
The system right now puts every American, unless you're really rich, exactly in that position. That's where we are today. That is the healthcare system in the United States. It is the least, we have the lowest level of coverage of any country in the world. We have more people excluded from healthcare than any other Western developed society. We have a system. And you think German, they don't have modern equipment. They don't have the latest drugs. Bullshit. We buy, for example, we have companies like Pfizer, that's basically the stuff came from Germany. You think German equipment is inferior? Look at some of the MRI machines. Look at some of the great X-ray machines or CAT scans. Some of them are made in Germany. Some are made in Japan. It's not like they don't have these things. It's just that, you know what? We don't want the poor people to get them. It's only for us, the rich people. That's not America.
Okay, you discussed doctors and doctors needing nurses. And then if you look at the medical system on an even with more breadth, you look at a hospital, and a hospital depends on, in addition to doctors and nurses, administrators, janitors, cafeteria workers. It's a whole ecosystem. It's a whole economy in and of itself. What do you say for the idea that if anybody's looking at healthcare just for their own self or their own family, the reality is we all need each other, and we need the whole system. You don't just need a doctor or
we don't
a
need
nurse.
The administrative system. That's what we don't need. What you're talking about is a huge slice of money paid to administrators and to pay to calculate all the things that have to be paid that go into an insurance. You have to have people say yes or no in the insurance company. You have to have a lot of layers of bureaucracy. You pay for that through the nose. And if you think that's good, you don't understand healthcare. Healthcare is dying because of administrative costs. Get rid of them. Same with look at pharmaceutical company. People hire experts, middlemen, who go out to find what kind of medical treatments insurance companies should approve. There's a problem with that. And that is those middlemen occasionally get compensated from the pharmas that are actually, selling their products. It doesn't work. We're paying for all these middlemen to get profits. We don't need them. And you're paying for it. And that's killing the healthcare system. Also, you want to reform the tort system where people get sued for medical malpractice, who overprescribe tests that don't need to be done. You can moderate the tort system too. There are lots of things we can do. But what we have now does not work. So if you want to have this stupid ass argument for the rest of your life, just think that there is a private solution that's going to make this work. It doesn't work. You got to get profits prioritize over healthcare. As long as that is your metric, you're not going to get an effective healthcare system. No, we've been doing it for like years and years. We passed Medicare in the 60s. We passed Affordable Care Act in 2010. We still have problems. Why? Because those aren't the answers. And people don't like the answer of, oh, we're not going to make it all private. No. Germany pays insurance companies to administer it. It works. Every other country solves it. Why can't America solve a problem that everybody else in the world at our level has solved? Why can't we?
Do you think we will?
Well, if we stay together and don't devolve, I think at some point we have to. And AI will either make it worse because no one will have a job, or alternatively, AI may be able to figure out. I mean, here's some wonderful things that AI does. Let's say you have breast cancer detection as a priority. And what you do, you say to the AI system, please look at this X-ray and tell me if this person is in an early stage of breast cancer. Here's what's happened. The system has taken millions of X-rays of women and has said, okay, this woman had cancer and here's what it looked like. This woman, and you do that 1 million times. The computer now looks for little things in that set of X-rays or whatever you're using and tells you you're early onset breast cancer. We can take steps now that will save your life. But if we are trying to save money, why would we want to improve the system? Because it costs money. Screw the women, let them die of breast cancer. Your mother, your sister, your wife, your daughter, who cares? I do.
So that system depends on the patients as being a consumer.
All patients are consumer of medical services.
As opposed to somebody who needs to get help, and we should give them a solution as quickly as possible because then they don't have to pay more and they have their health quicker.
How about we also stop pandemics before they get out of control? How about we give children healthier lifestyles so they can succeed and be more productive and create more wonderful things in our society? Just little things. How about making our products more competitive in the international marketplace? We're competing with countries that have universal health care. They pay less for it. And that is reflected in pricing structures.
What does the United States do right now to prevent diseases abroad from touching our population here?
Today, nothing. But until January 20th, and a certain car maker who makes really ugly cars, the ugliest cars on the planet, I don't want to mention Mr. Musk, went out and basically gutted U.S. aid. Those diseases are proliferating like crazy. People who were in the middle of treatments for diseases that were absolutely preventable or curable are now just dying from them, and the diseases are beginning to proliferate everywhere, and they're going to come back here. We're going to die from it, or we're going to get sick from it, because we don't care. We don't trust the Centers for Disease Control anymore. I don't. I don't think most doctors do. That's why we have California and a bunch of other states, New York, others, that are basically saying, you know what, we're creating a parallel CDC structure. We will follow our own statistical realities. We'll hire the best and the brightest that were fired from the CDC. We'll bring them into our system. We'll replicate it as best we can. Not that I have any opinions, mind you. Look, what's funny, you can ignore me and say, we're not going to do that. Okay, don't. You're going to have more disease, more sick people, more people going bankrupt from medical issues, and rich people saying, yeah, I got a new jet.
Well, you're giving an opinion, and the test of time.
Test of time's already passed. I mean, we are here today with this problem now. If you think we don't have a problem now, if you think we didn't have a problem in 2010, our problem in 2010, when the ACA passed, is millions and millions of Americans didn't have any health care at all. ACA fixed it somewhat. It provided a few million people who didn't have health care, and they got it through the ACA. Now we're talking about Republicans trying to get rid of the ACA, get rid of the subsidies, and put it back into the private system. You want to go and get insurance and find out, oh, you had a broken whatever, you had a disease, you have a liver infection 10 years ago. Well, we'll cover you. It'll be an extra $2,000 a month, thank you, or we won't cover you at all. That's what you're going to face. All the pre-existing conditions, all the work that we did, pre-existing conditions, 40% of Americans have pre-existing conditions. So you're talking about socking it to that 40%. I don't want to do that.
Me either.
Well, you know, I keep saying, if other countries have solved this problem and they're prosperous, doing fine, why can't we? What is it about Americans? Are we too stupid to figure this out? Bullshit. We're smart. There are enough of us educated so far, and we're going to lose some of those coming up. And Gen Z is smart. They figure stuff out. They've actually figured out how to use AI in ways that old farts don't have a clue. Gen Z is our salvation, not our burden. Gen Z is going to provide the answers we all are going to looking for, and they'll know what to do with it. We need them. Let's get rid of the coots who say, I have a conspiracy theory. I don't believe in vaccinations. Bend over, incoming. Okay.
Okay, this is a little bit different of a question, but what is open enrollment? Why do we need it? And I'm guessing it's just another bureaucratic distraction to keep us stuck in this hamster wheel. But beyond that, what is it? And why do we?
The reality is, it's an interesting marketing philosophy. We're going to tease you with some things that you can get if you get this policy with us. Like maybe you get hearing aids, or you get vision, or we cover more things if the doctors are in our system, and you don't have to pay for stuff that Medicare misses, the donut hole, et cetera, et cetera. What they don't tell you is you're buying into a whole new set of limitations and caps. So it's not like you're getting a wonderful new thing. You're getting a thing with some new stuff in it and some caps in it you wish you never had. Because now you're having to call up the doctor before you do things, and the doctor has to call up the insurance company and get permission, where before you didn't have to do that.
But if you want to get insurance or change your plan, you can only do it during a specific time period.
It's a game.
Yeah, why? Like,
It's basically a statistical game, so there's predictability in the system, so that basically Medicare and other people know how to deal with it. Look at how much a doctor has to fill out in terms of forms. Look at the compliance. Look at HIPAA. Look at all the restrictions that are placed on doctors, the disclosures, the limitations. It's not fun. I mean, my wife works in medical coding and billing, and she spends a day not struggling. She knows what she's doing. She's very efficient, but she's dealing with that bureaucracy. Doctors sit there. Maybe they have an iPad and it's nice and fancy and they can input stuff as they go. But you may have noticed when you go to a doctor's office today and you're being looked at by a high-level physician, very frequently there'll be someone with them. They'll either be a medical tech or an intern, resident, working to take notes as the doctor makes examination. Those notes are then printed out or put in a file so they can be accessed. The bureaucracy of medical practice is absurd. One of the things that's fascinating, my friend in Germany went into the hospital, major costs. I mean, hundreds of thousands of dollars of costs. And then when he was finished and they said, okay, you're healthy, he left. No forms, nothing to sign, just walked out the door.
is that because of like malpractice and the legal risks that doctors face, or is it professional regulation for their
It's all about money. And look, malpractice is malpractice. You can do tort reform where you can limit the amount of damages, you can limit punitive damages, you can do all kinds of things. We have done some of that in California. There are caps on certain torts here in California. We can expand that. You know, if doctors are being charged $150,000 a year for a very elegant, malpractice policy, maybe we can cut that back. We can do a lot of things to make medical costs better, not worse, better. Having all these doctors with malpractice looming over their brains often causes them to require testing that isn't really advisable. It's just superfluous. It's like CYA, cover your ass, take the test. Well, he doesn't need it. Yeah, but I would be sued if they said, why didn't you do this MRI or get this CAT scan? I got my own CAT, does my own scanning. But why do they order all that stuff? They don't need all of it. I had a conversation with a doctor today on one procedure, and he said, look, I can make you a little bit better and probably would help you a little bit. It's not worth it. Don't do it. I like that kind of a doctor. He said, you can live with this. If it gets any worse, I'll take care of it, but don't worry about it. I like that.
Okay, Peter. So what does a United States with universal health care look like on a practical level to individuals like you, me, and our neighbors? And what does that describe the paradise that you're talking about?
Well, it's not paradise because it's always going to need fixing. Medical needs change. The number of people covered change. Look at Social Security. We're financing Social Security based upon a system that was originally 35 employees who were working for one who retired. Today, we've got 2 workers for one person who retired. Clearly, the financial structure for Social Security doesn't work. So you have to adjust things as time changes. What would the system look like if I had anything to do with medical school and student loans for medical stuff would be dissolved slowly over time. We'd get rid of those. We would require doctors when they graduate, nurses when they graduate, to donate a couple of years of their lives to work in rural hospitals or to help the system get better. They could go in the military. They could go, by the way, military pays people to go to medical school. And it gets 5 years of their services. That's not a bad system, but it doesn't have to be the military. We need doctors. Let's put them where we need them. If there's a town in Nebraska that's 100 miles from the nearest hospital and a small clinic might work, okay, let's have a small clinic there. Let's start taking care of all Americans, not focusing on the big cities with the superstar hospitals like New York, Los Angeles, San Francisco, Seattle, Boston, Houston, whatever it is. Let's give a door for medical treatment to every American. Number one. Number two, let's start cherishing our doctors and let's start capping malpractice claims or creating alternative medical systems. If you're in the system, you have to go to a medical court where doctors, nurses, and lay people sit and look at what's going on. They're used to judging and determine whether or not you did create malpractice. With caps on things like punitive damages, we can do it. And people can still have responsible doctors. Look, you see a doctor do something horrific in a hospital. How many of those doctors are still practicing years after they've done all kinds of crap? The systems in the hospital let laggards stay. Too many hospitals don't care. That's just wrong. We need better standards, better enforcement, and we need to protect our doctors. Everybody makes a mistake. The system has to accommodate that. People who do nothing but mistakes need to be weeded out.
So it's not paradise on a practical level because it's still a practical part of life that is troubleshooting problems like health issues. But it's more efficient. It's incentivized by the right factors, by the right interests. Instead of profits, it's incentivized by troubleshooting health issues.
I mean, you can have medical systems where doctors are paid only as long as the patient is healthy. There are all kinds of systems that have been used around the world. We should be able to figure this out. I'm not going to sit here and say, I've got the answer. What I know is there's a problem and there are many answers and they need to be adjusted over time. I know that what we have today is not the worst thing in the world. The ACA is an okay system, but instead of tearing it down and try to create some crap substitute, and that's what the Republicans propose, a crap substitute, let's fix it.
And one reason to fix it, which I heard you say, is because right now medical bills pose one of the biggest sources of bankruptcy for personal families. So in terms of
Not one of it is the largest.
Is the largest. So even whether it's on a macro level for the country, you mentioned so much medical waste in terms of money, and then on a micro level for families or individuals, it's a big risk to wealth building. So even if we were to look at profits and look at them honestly and in reality, even that is reason to change our system, even if we do focus on the money.
I'll give it, focusing on the money, unfortunately, the metric that you use, how much money does such and such a healthcare system, insurance company, etc., make? If you look at that, it's an easy solution.
Well, I guess I was actually conflating something. I was conflating profits for the big companies with numbers for the country or individuals. So what you're saying is that there's a choice between profit and healthcare, and we need to choose healthcare. And on an individual level or for a country, if we look at the numbers, looking at the numbers actually bode for healthcare.
There's a reason why out of the 38 countries in the OECD's high net worth countries, only 6 countries don't have the kind of healthcare, universal healthcare or near universal healthcare. Why are we the odd person out? Because we use the word socialism. That's probably the only reason I can think of why we do. Rich people say, if I can use the word socialism and I don't have to pay any taxes if I say it loud enough, and then help the young or not so young people who are not rich get sick, what the fuck do I care? I don't care if they die. Remember, they're winners and losers. And anybody who's not in the billionaire, centimillionaire category, they're losers. They don't deserve to live. It's sort of like you see a cockroach, step on it. It's cheaper than having your food get dirty.
Even if somebody says, okay, it's socialism, and therefore I don't want universal health care. So what's the fear behind socialism? Why does socialism make that? Why is socialism? What's the fear behind it?
The fear behind it is called the baby boomers and a little bit X generation, because we grew up with duck and cover, and it didn't involve any ducks or any covers. But we basically conflate communism, socialism with our enemies. And Joseph Stalin was a big bad dude. Mao was a big bad dude. We didn't want to be like them. And these guys were going to Latin America, toppling, democracies and replacing them with strongmen. You think Chile, which just elected the first right-wing president since Pinochet? Pinochet was somewhat to the right of the Sheriff of Nottingham. People were dying in droves. Right-wing it represents a constituency, and the constituency is almost always a plutocracy of oligarchs. It's not people who said, let's take care of people. They also look at Fidel Castro. They look at the societies that they think are failed societies. We don't have to look like that. We can look like Germany. We can look like Sweden. We can look like France. We can do this. We don't have to say, gee, if we adopt this, we become Cuba. No, we don't. Unless you like Latin American music more, you don't. And that's weird. They always like to pick up. I always find this is a basic rule in my analytical set. If people support their position with anecdotal expressions and catchy slogans, I write them off. Because anecdotes you can find an anecdote to support any position. But statistics tell you what the vectors are, what's really going on. And if you censor numbers, if you censor statistical analysis, you can do anything you want. And rich people, I'm not saying this is a uniform, I know a lot of really kind and generous rich people, but there are a lot of them who just say, you know what, screw the little guy. I don't want to give him a raise. What, $1 an hour? Not paying it. Whatever it comes down to, right now we're hitting a crossroads, and that crossroads is the result of most stupid policy in healthcare in the last 30 years anywhere in the developed world. We pick the lowest. We pick the worst. We pick the least efficient. Why? Because rich people thought, that's socialism. Hey, I love that word. If I put a label on something, I've solved the problem.
Okay, so if you're in with a group of people. Some people are going to have an insurance card in their back pocket. Some people won't. Some people will have access to Medicare or insurance through their job, their employer, or through the military. Others won't. Either they don't qualify, they can't afford it. Inevitably, inherently, in society right now, anywhere you go, some people are safe and have access to doctors and some aren't. So for the people who are safe and have a card that they can take and use to see doctors, what's the incentive for them to care about the people who right now don't have access to doctors and don't have access to getting their self-help?
Ever hear the word contagious? Does it ever make any sense to you? The things that are contagious, especially when you have an epidemic or a pandemic? Does that matter to you? In other words, if you allow lots of sick people to wander around because you deny them access to health care and the disease comes and bites you, say, well, if I get the disease, I'll go to the hospital. What if you didn't get the disease in the first place? All of these are really inane questions. Like if I'm in Germany or I'm in England and I have an accident, this actually happened in the UK. I was with my wife. We were in the UK. She fell down, broke a bone. And we just walked into national health care. There's no pill. They didn't have to fill anything out. We didn't have to prove we weren't UK citizens. They didn't care. We were treated. And ultimately what you're seeing is, what is the real cost overall? Why are we looking at what it is? Like right now, if you're an undocumented alien, you can't get Medicaid. If you go to a hospital, what are you supposed to do? Bleed out? Maybe that's what they want. I find that our approach to immigration and people from other countries to be cruel, stupid, and absolutely self-defeating.
And I hear you say, like, have you heard of the word contagious? Clearly I have, and clearly everybody has. That word alone isn't working. Like,
you know what?
I mean,
we need more dead people. We need people to suffer more from their decisions. Is that the answer?
No.
Well, you can't force it. So as long as people elect politicians who use the word socialism, the way I like, would you like a glass of water? They put a label on something, they think they've dealt with it. You're not going to get anywhere. Our educational system in the United States is among the worst in the developed world. This country, with its public schools, used to be first in the world back in the 50s and 60s when I was in school and in elementary school and stuff. All I can tell you is our schools were great. Today they're shit. We are looking at 19th to 38th in terms of math and reading scores. So if you have an uneducated public being cast pablum by people who are in leadership positions, and those people who failed to get the education that they're entitled to are basically outsourcing their opinions to dumbasses who don't care about the people. And they found that the word socialism, if they can use it and attach it to something, gets those uneducated people to vote against themselves. They're going to do it. So you got a lot of problems that are interrelated. You have to solve a lot of them. But I can't help you if you can't think or think without referring to some other manipulative asshole who wants you to do something because it benefits their constituents and makes them money. I can't help you. If you want to slit your wrist, it's your wrist. We call that risk.
That wasn't directed at me.
We call that risk taking.
Although I will say this issue is personal to me because I don't qualify for Medicare. I'm not part of the military. I don't have a way of getting insurance aside from paying it for myself, and it keeps going up each year in high numbers, and it's like mind-blowing. It's one of my biggest budget items along with my housing, and that's just like, there's got to be a better way, and that's just looking at my personal life.
You are very typical. You're not out of the ordinary. Most people these days, the big corporations that hired lots and lots and lots of people, take a look at the banks that laid off people this last week. You had, I think, Chase is closing 66 branches, and you go down a list of all the banks that are laying people off. People are being replaced by AI. We're having the worst jobs report we've had in a long time. We lost, we picked up, I don't know, we lost 64,000, but we picked up 100,000 but that's a net loss of, and all these government people who are being laid off, what do you think that does to the system? You think they don't need medical care? They all need medical care, and they can't get jobs. What about Gen Z? Gen Z is going out and saying, I went to school, I got a degree, I went to trade school, I went to college. Nobody's hiring me. All these people are job hugging. Why am I stuck? Or if I get sick and I'm over 26 because then my parents can't cover me under their policy, what do I do? And the answer that the old folks says, we don't care about Gen Z. We screwed you once with the educational stuff. We screwed you another time with housing costs. We're screwing you once again with medical issues. That's the way it is. Get over it. That's not an answer. Donald Trump, stop it.
Yeah. And not to make this about me, I'm just using myself as an example because that's the example that I know of. But I think if I work so hard every day, if I work this hard and have gotten myself to where I am and I'm scared about the financial risk and the health risk that could be on my doorstep at, we're all like 1 degree away from financial risk and health risk. If I'm in this situation, then I can't imagine. Well, I can imagine. That's what the problem is. So,
well, right now we know that 40% of, I guess, a quarter of all Americans, at least, or more, if they got an emergency bill for $1,000 for something they had to do, they can't pay it.
mm-hmm.
They don't have the money for it. So what you're talking about is a healthcare crisis, but it's also a structural crisis, and we haven't answered the question. What kind of country do we want? We don't answer that because the strange thing about, you have someone like Donald Trump, and you say, God, I think I could be that rich. No, you can't. He inherited his wealth, but even if you look at the people who are the really bright people in creating new technologies, that's under 1% of the entire educational system of the United States. So if you are basically saying, I'll let people get rich because I think I'm going to be one of them, you're lying to yourself. I can't help you if you like lying to yourself. It's fun, it's great, but it doesn't work. So at some point, we have basically in this country put a giant wall between truth and wannabe truth.
But even if somebody said, I'm going to be rich, and they make it, okay, so then you're situated with wealth. Do you then only care about your own health?
Pretty much.
Being rich all of a sudden...
See, you're coming at it from a human being that's lived a human life. If you grew up every year of your life from the time you were a little wee wiggle woggle, and your family had $10 million a year coming in, you wouldn't even think this way. You would think, you know what? God gave my family this money. I worked for it. My father worked for it. We deserve it. Why do I have to share the money my family made with people who didn't work for it? That's the argument. The reality is you couldn't have made it if you were in a different society. This society enabled your success. So we need to say you need to pay for the right to have been enabled to be successful.
So back to your question, what type of country do we want to live in?
Yeah. And right now we're living in one where it's run by people who are very rich at the expense of everybody else. That's what we live in. We live in a country where the king wants a ballroom and he builds it. Doesn't ask anybody, he does it. King doesn't like the people in boats crossing out there, doesn't talk to Congress, doesn't talk to a judge, just kills them. At some point, who are we? What does the Constitution mean? What do human rights mean? What is a country of laws versus bylaws? Of laws means you're governed by extrinsic, popularly decided statutes and rules. Bylaws means you're the dictator who tells you what the laws are. I don't like the latter.
I don't have any more questions for today, but I look forward to our next episode. And I appreciate the episodes before this one where we continue to just identify issues and discuss possibilities and potential solutions. Not that we have answers, not that you have answers, but discussing them is definitely a way to take steps towards a better, constructive.
I asked the question, what do you want? And can you do it? The can you do it addressing Americans, I believe passionately in our wonder. we are smart, we are capable, we can solve the problem. When you say, I don't want to solve the problem, I don't like that answer. It tells me America isn't great, never will be great. But when we got great, we got there because people built this country. We got to keep people building the country. And unlike the past, back in the 1700s, the 1800s, if you were 35, 40 years old, you're way over the hill. We aren't there anymore. So we can't hold ourselves to the standards of the 17th, 18th, and 19th centuries. We need to get modern, and we need to be able to have expectations of life expectancy. But life expectancy in the United States is declining. It's going up elsewhere. So it must tell you that the system of medical care we have must be worse than those in countries where the life expectancy is rising.
And the one thing that's for sure is health is our most precious resource. And I don't know if I could look at anybody and say that my health is more important than theirs. So on that principle,
there are a lot of people who make that statement every day. Their whole business plans are predicated on that statement. I don't like them either.
Okay, Peter, we haven't solved the world today, but...
we can't. He starts by saying, I want to solve it. I'm ready to solve it, and I'm going to put the best minds to solve it, and I'm going to get all the people who make excuses out of the way. You got to make a decision. You don't have to have a better life. You don't have to live longer. You don't have to be healthy. That's your choice. We make the wrong choices, and we trust the wrong people.
Bye.
Microwave.
Thank you. If you would like to give feedback, suggestions for new topics, or have a question that might be selected for a future podcast, please email us at dekompodcast@gmail.com. Thank you for listening. Until next time.